The pandemic has exacerbated issues right across Canada, including the country's opioid crisis. A new provincial report is shedding light and highlighting just how bad the situation has gotten, with more deaths being reported. Harm reduction experts say though COVID-19 may have deepened this crisis, these issues and problems existed long before the pandemic.
Overdose deaths in Ontario increased by 79% between February 2020, the month before the pandemic started, and December 2020. So that's 8 people a day in one province alone.
The report on Ontario's opioid-related deaths during the pandemic shows there was a 60% increase in fatalities from the previous year. In 2019, there were 1,517. Last year, 2,426 deaths.
There's an exhaustion from the accumulation of death, the accumulation of grief at having lost colleagues, friends, organizers, clients. So I think that, my reaction is one of anger. It's one of grief.
There have been widespread increases in opioid-related deaths in a number of provinces, including in British Columbia. The numbers are just as alarming in Toronto. The Public Health Unit reports there were 521 opioid overdose deaths in 2020, a 78% increase from the year before and 280% jump from 2015. And prior to COVID-19, the average number of fatal calls of suspected opioid overdoses paramedics attended per month was 12. During the pandemic, 26.
This has a human toll, right? We're talking about a mass death. We're talking about a devastating loss of lives that is just continuing and continuing to worsen.
The Liam Michaud of the Toronto Overdose Prevention Society says there's been some progress on some fronts that has still been limited.
This is a trajectory that has been building for years. And more than anything, it's about a stalled response on the part of all 3 levels of government.
The report, completed on behalf of 4 parties, including Public Health Ontario and the Ontario Drug Policy Research Network, states, quote, "This increase in drug-related deaths was thought to be driven by a combination of numerous factors, including an increasingly volatile, unregulated drug supply, barriers to accessing harm reduction services and treatment, and physical distancing requirements leading to more people using drugs alone."
There's no coordinated centralized response province-wide. Every level of government has an important role to play. They're really, really invested in passing the buck.
Michaud says it's especially vital for the province to provide supports to harm reduction programs that have been defunded recently. This report also reinforces calls that have been made for years now, saying it must be a priority for communities and all levels of governments. Quote, "The expansion of access to harm reduction services such as safer spaces to use drugs, access to naloxone, low barrier opioid agonist treatment, and a safer supply of regulated drugs."
We're calling on the federal government to immediately enact full decriminalization of personal possession, as has been proven to reduce deaths, improve health outcomes.
Now, there are also some intersectional issues that exist here. The report noting that opioid-related deaths more than doubled among those experiencing homelessness. That has led to renewed calls for supports to this population, including adequate housing. Michaud also adds that it's vital to implement and enforce low-barrier overdose prevention sites at both hotel sites and shelters.